Welcome back. Here with us is a multiple award-winning Nollywood actress, the beautiful Kate Ensure.
Thank you.
Thanks for coming.
Thanks a lot.
Now, Kate, have you ever had to use any health facility outside the country? If yes, what was your experience like?
Basically abroad to go for a pap smear. Because if you leave abroad, somewhere like in the UK, when you're over a certain age, they normally would send you reminders, send you that, oh, it's time for you to come for, I'm correct? Yeah.
Sure.
Send you a letter, you come for your pap smear, and it's time for you to check it. But growing up there, I didn't know those kind of things, you know, that even they do it here.
Some people would like to know what is pap smear. Sorry to cut you. Sorry.
It's a female thing.
Okay.
I will let the doctor explain.
Okay.
Yeah. It's for females.
Okay.
Over a certain age.
Okay. I'm sure the doctor will talk more on that. So
yes, so just to check that everything is in working order. That's basically it, not any major operation.
So what was your experience like?
It was lovely. I had my appointment, I went in, it was done, and they sent me my result through post.
So can you relate to what we have back home? If you want to compare?
I've not tried it out here because I wouldn't know where to go. No, I would, let me say. I've decided over the past few years to do a thorough routine medical check on myself.
Okay.
At least once or twice a year. And I did that in a hospital in Apapa. Got all my do's and don'ts. And then I'm going to do it sometime at the end of this month again.
Oh, okay. So over to you, doctor. Let's hear your take on what's pap smear.
Well, thank you. Pap smear, like Kate has said, is something that is done routinely for women of certain age group. For you
What's the age group, please?
For you to screen for cancer of the cervix. So, you know, it's a public health issue in terms of screening and getting them early.
Oh, okay, good.
Because that is the rule, really. If you get cancers early, it can be treated to a curable level. But the problem is we miss out of that early period. And they come in when it's so late to do anything. And that's why we lose all of them.
Wow.
Or most of them. But with that kind of
is there awareness on for females?
There is a lot of awareness going on right now. And I'll also add that there are a lot of places you could do pap smear in Nigeria right now. We might not have that kind of appointment system, but that something going on now in Lagos State. Very soon, there will be a very beautiful appointment system.
Oh, that's great.
And people wouldn't have to go and queue in hospitals anymore, particularly in public sector. You know, the modalities are being worked out, that people will not have to go very early and stay late till they leave there. They will be given their appointments, they will go and they will leave, they will see the doctor before they leave.
Oh, that's good. Then while you were talking, that's good, yeah. While you were talking, you talked about age brackets. What, can you be specific? What age brackets are we looking at?
Well, you really want to have it for adults, really.
Okay.
Yes, adults.
For adults.
He's a good doctor.
A round of applause for our doctors.
Very confidential and precise.
So another question for Kate. Have you had an experience where a person was either mismanaged or was ignorant of the existence of a specialist?
Maybe in conversations with people, because what people will do is they tend to self-medicate, or somebody will say, oh, you have this boil or something, this is what I used. It works for me, so it will work for you. But then our systems are totally different.
True.
So everyone needs to actually go and see their doctor, and then your general doctor will now refer you to a specialist. If that is ear, nose, and throat, gynecologist, obs, and guy, all this, you know, there are people in different areas who handle different parts of the body. But I don't know of any situation. People will always self-medicate rather than go and see the doctor and you pinpoint and say, this
I'm sure
is exactly
Dr.
what's wrong
Inoigai
with you.
wants to say something about that.
Oh, sure. We often do that. And earlier on, I explained to you that the population cannot be blamed, because right now, by UN categorization, our literacy rate is just 6.1. And you can't compare it to a country also like Egypt, which is also in Africa here, that has 7.2. And like I earlier explained, a lot of people don't even know what they are doing. Most times we self-medicate, and it's very dangerous for us. You know, we don't feel comfortable enough to access health. There are various reasons people give, and somebody like Lagos State is all out to remove all those obstacles that will keep people from accessing health. Is it that you are financially afraid you go in? Is it that it's too far from you? They try to make it as close to you as possible. Is it that there are not enough doctors near you? They try to keep that. And like I said, they keep getting you aware with this kind of partnership we have with you as well. And in terms of the screening, the everything, they keep on doing something. We have a regulatory system as well called the pharma in Lagos State that goes round to hospitals to ensure that they also practice well, their facilities are up to standard. Even this drug abuse, really, this is the first time I'm coming across them distributing Panadol in parties, maybe because I don't go to parties so often. Maybe. So, but to be honest with you, that is not supposed to be. No. But if we make the population aware of these things, and then we stop those things happening, then we will not have, we'll have less. Like I told you, there are a lot of increase or rise in kidney failure now, and there are various reasons for it. People just throw it down. Oh, you took Panadol for it, okay, I'm just throwing down Panadol. Oh, what did you use for this? I think I'll use that too. No, but it may not really apply for you. You might need to see the doctor to clarify what your own status is.
Thank you very much.